many differences in obesity-related diabetes and cardiovascular risks among different age groups, gender, and ethnicity. This is because of the differences in genetics, hormones, lifestyle, and social determinants of health. We have to take into account all of these things, and this is why we say obesity is a chronic disease and needs to be treated individually, and you must have a personalized approach. It is not a one size fits all. As people age, metabolism slows down, muscle mass decreases, there may be an increased risk of insulin resistance and heart disease. Younger individuals with obesity can develop insulin resistance even earlier, leading to higher lifetime risk of type 2 diabetes. Men and women are different when it comes to storage of visceral fat. Visceral fat is the fat around your organs, the fat that increases our risk for heart disease. And men tend to store more visceral fat early on. However, for women after menopause, this is the time that we start having a shift in our fat, more from the subcutaneous fat, more to visceral fat. The subcutaneous fat was the fat that didn't affect our health long term. And as I mentioned, visceral fat can. So after menopause, a woman's risk increases for all of the same things that the men had the risk for before, as far as cardiovascular risk, diabetes, and metabolic health. There are also ethnic and ethnic differences. So African Americans and Hispanic populations have a higher rates of obesity-related diabetes, even at lower BMIs. And Asian populations develop diabetes and heart disease at a lower BMI due to increased visceral fat, insulin resistance, and low muscle mass. So for instance, I'm an Asian female. My BMI numbers are not the same that I would compare to a Caucasian patient of mine. We have to look at all of these differences when we're determining a treatment plan for your long-term health.